Hello class. This short presentation is designed to provide you with skills that will improve your test taking. Please take a bit of time to go through this. You may consider saving it because in the future you may want to refer back to it when you are getting into actually more tests. And you will, I will send you the link if that is something you would like to do. So when it comes to studying for tests, just a few things. We talked about good study skills, but start preparing for any test the first day of class. Make sure that when you have tests scheduled, you write it in your calendar and think about how you're going to divide up the material to study for the test, and set aside time each day to review the material so that the day of the test, it is a matter of just reviewing and not cramming for a test. Make sure that you complete all your assignments on time, and like I said, review the material. Do any extra assignments. So many times it's easy just to turn your work in, but if there's test questions at the end of a chapter, make sure that you do that. Make sure you read every box that is in your book, every chart, anything that is on a written page or on the e-books. Make sure that you are including that in your learning. If you continue to study every day and review the material on a regular basis, that is how you build the information. If you don't understand anything, make sure that you look it up. The material that you're reading about, you may not feel it's important on this test, but it may be building up for future. Many students use Post-it notes as a way to flag material or reminders to go back and study that material. When I say read material in chunks, it means that if you are studying for a test on, let's just say, appendicitis, you might read about what causes it first, nursing care, medication second. You want to divide it up so that everything you're studying is in a chunk that relates to itself, so that you're not being scattered. Or another example is if you're studying for a med-surg test, you might study neuro on one day, musculoskeletal on another day. So you're keeping all that information together in your mind. Some people use flashcards or index cards. If you find that taking notes is important, that's a good thing to do. Drawing a concept map is a good way to store that information also. When you are analyzing tests, you should go back and review the test. This is obviously from a different institution, but you may go back and review your test with your instructor. Take the information that you have from your instructor during lecture, listen to lectures over and over, map out the course, and outline the course content is another suggestion as far as studying for the test. Use mnemonics, we talked about that in study skills. Anything that's going to help you remember, songs, anything that will help you remember, especially information that is information that you need to just memorize. For example, lab tests is information that you really just need to know the results. Break up your study sessions into manageable times. Again, I said plan ahead what you're going to study so that when you sit down, you're organized and know you're going to study chapters 1 and 2 or neuro versus musculoskeletal, and you have that organized so that when you're ready to study, you know what you're planning on studying. We talked about this, maintaining a healthy lifestyle, and most important, never ever cram for a test. It is the worst way to study. You want to study on a regular basis. The reason you want to retain this information is because at the end of your nursing education, you'll be taking a very important test called the NCLEX. So you're building on knowledge so that when you have to take that test, you have that knowledge from over these last years of studying. If you think study groups are important for studying tests, make sure that you find one and organize one. Sometimes it helps to gather information or get information from another individual. This may sound kind of silly, but it is important, and research has shown that if you have a positive locus of control when you go into a test, that you will do better on a test. So instead of going into a test and saying, I just don't think I can pass this test, that will probably or may set you up for failure. You want to go in feeling like you have command over the material and you will pass the test. Of course, by studying on a regular basis and building up your knowledge base, that will help you develop this locus of control. If you have test anxiety, start practicing controlled breathing. You can use guided imagery so that if you think that you're going to become nervous in a test, you can think about something like waves or leaves rustling in the wind or something and focus on that to control your breathing so that you can just get rid of that extra anxiety that may be occurring when you take the test. These things are also useful when you're taking the NCLEX. So the right attitude is knowing what is your role, having good learning goals, studying efficiently, and achieving better goals. So getting that command of your education is really important in how you're going to do on tests. So what positive attributes do you have? Well, you're good at studying because you've set up this great study schedule and you've got good study habits. You're interested in material. Becoming a nurse, there's always something new to learn every day. You're not going to know everything, but it is such an exciting field to be into because you're learning so much about health, even your health, and it's just a very exciting field to be in. So you are learning, you're receptive to learning new information, and you are independent enough that you're going ahead and studying without the instructor telling you what you have to do. You have a good support system, you're taking care of your body, and you continually tell yourself, I can do this. We talked about this earlier, that you accept responsibility, you participate, you ask questions, and you take charge for your own learning. And again, maintaining a healthy body is important. When you are taking a test, some things you need to think about are, and this is again basic, but if you're taking a test in class or in the NCLEX, you want to have some control over just the test part. So that means making sure you get to class on time, making sure that you get there early enough that you are able to take a break, get organized, have the appropriate supplies, that you're comfortable. This can also apply to online tests, that you're making sure that you're not taking that test 2 hours before the test is going to turn off. You want to make sure that you have enough time. You want to be comfortable. You want to have a quiet space where nobody's going to bother you. And sometimes your personal comfort might mean you're in something very relaxing, such as maybe workout clothes. But if you find that you do better being dressed up, you might want to get a little bit more dressed up to take that test because that could give you the edge. Make sure that you have organized your material when you're studying for the test. When you study in a regular manner, it actually helps your recall so that you can recall the information. Maybe you had it all on cards or concept maps. That will pop into your mind, and sometimes it's not even a conscious click in your mind. It's subconscious, and it helps you come to the right answer. Associating new material, looking up definitions, and working with distractors are all points in taking tests. If you are taking a classroom test, think about where you want to sit. Sometimes it's better to sit in the front of the room. However, if you find that's distracting, you might want to go more towards the middle or the back. It depends upon what you find distracting. If you're near a window and if you're distracted by it, then make sure you're not sitting next to a window. Make sure you have all your supplies needed for the test, whether it's again online or in the classroom. Remove all distractions. Again, if you are taking a test at home online, make sure that you do not have your cell phone nearby. If you have children, try and schedule a babysitter so that you have time to take the test without any distractions. If you're able to go through the test quickly to get an idea of what the test is like, that is a test taking strategy. However, in the big picture, you will not be able to do that with the NCLEX, so that's not always a good idea to use that test taking strategy. As soon as you begin your test, take a few deep breaths, relax. Do that throughout the test so that you make sure you're maintaining good oxygen to your brain so that you're using every brain cell you can to answer the test appropriately. Read the directions carefully. Read each question carefully. If you're in a classroom setting, you have a question, ask the instructor, but make sure you're reading all parts of the question before you answer it. If you are using a time test, one way, and you can do this during the NCLEX, so this is a good study habit to do, is you take a piece of paper, you ask the instructor for paper, or if you're at home, and you mind up. That means you write everything down on a piece of paper that you can think of that you might need to remember for the test. For example, if you're studying metabolic acidosis and you need to remember equations, things that take place during acidosis, you might, as soon as the test starts, you might want to write them down as fast as you can on a piece of paper so that when you come to a question about that, it's all drawn out and you have your answer basically right there. And it's not cheating because you're doing it after you start the test. When you're taking online tests, do not use your textbook. You're practicing to take these tests so you can take the NCLEX. You won't be able to use a textbook then. So learning to take tests online without any textbook is very important. If you have a time test, make sure you're keeping your eye on the clock so that if you have 1.5 minutes per question, you are allowing yourself enough time to complete the test. When it comes to different types of test questions, there are cognitive level test questions, nursing process, client needs. Cognitive level questions just means that it goes from easy questions such as knowledge-based to a little higher level question, and I will show you what that means. It might be a nursing process question, which means that you might be asked parts of the nursing process. So if you're being asked an assessment question, something about assessing the patient, make sure that the answer is an assessment answer versus if you're being asked a nursing intervention question, the answer has to be an intervention. Client's needs, we'll get into that in a little bit. This is how the NCLEX is broken up, and as you go through nursing school, you will see that these are the categories that are used on the NCLEX blueprint. One of the things when we talk about test taking strategies is have confidence in your first response. Usually that initial feeling is correct. So unless you are 100% sure that that is a wrong answer, I say never change your answers. Do not guess at answers. When you learn about test taking strategies, it's another way to come to a way to answer the question. So some of the test taking strategies that you see are many times the longest answer is the correct one. Don't count on it, but that can happen. If you're taking a test with multiple choice and you think you've answered C too often, the whole test could be C, so don't even consider that. Look for grammatical inconsistencies. If it's a plural or a singular, sometimes that can give you a direction in how to answer. Look for options that are similar. When it comes to many nursing questions, if you look at if it's a multiple choice, many times 3 of the answers out of 4 are similar. So if you have 3 similar answers, then you know that those are probably all 3 wrong, and the one that's not alike is the correct answer. Look for incorrect and correct options and eliminate them before you answer the question. And always identify what are you being asked, what is the question asking, before you go into looking at the answers. Many times you can get a test question answered from something you had answered previously, so be aware of that. Be alert for details and read every question, and again remain calm, because panicking or getting nervous will not help you answer the question. Be alert for keywords. Now keywords, there's a list of keywords I will be explaining in a few minutes, but also keywords are such things as, are you talking about the patient? Are you talking about the nurse? What is actually being asked in that question? And mentally underline those keywords. Use all your knowledge and clinical experience, and then now you will have test-taking strategies to work with. So when you are reading a question, avoid reading into a question. Sometimes it's easy to read the first part of a question about a patient, and then you start imagining what else could have gone wrong, and that's what's called reading into the question. You're adding information into the question that didn't belong there. So when you're reading a test question, make sure that you read the stem of the question, which is what is leading you to answer the question, and then read your options. Use the process of elimination. If you get down to 2, and that's not unusual, go back and reread the stem and see if you can come up with an answer. So keywords, like I said, get you to focus on what is being asked and help you to eliminate the wrong answer. One of the ways is identifying the client or whatever the focus is of the question, or what is the issue. It could be medication, it could be side effects, nursing interactions. So identifying what is really being asked. A question that might be related to pharmacy is, are they asking about side effects, or are they asking about contraindications? 2 very different things, but if you get those 2 confused, you will most likely come up with the wrong answer. So make sure you read each answer carefully. Words that are keywords, especially when you have a true or false question or a true or false type question, are words that look like this. Most likely best judgment, initial, first. Whereas a negative response looks at these kinds of words: lowest priority, incorrect, unsafe. If you're having a priority question, these are the words that you will see: initial, essential, vital, immediate, highest, best, most, priority. So that is usually related to what would you do first, what is the most important. I'm going to give you a little test here and talk about test-taking strategies. And believe it or not, there is an answer to this test question. So please read through this test question and then look at your 4 answers and try to determine what would be your best answer. And I'm going to tell you. The best answer, if you had to take a test-taking strategy guess, would be these 2, because this word is found here and this word is found here. An example could be a question about a patient with osteoporosis and needing calcium, and maybe one of the drugs listed below is calcitonin. So you see that calcium, calcitonin, you make that relationship when you're answering that question. This is a grammar-related question. So if you read this stem, you notice that this ends in an, and if it ends in an and, the next word has to start with a vowel, so that's why that would be the correct answer. This looks at absolute questions. So in these answers, there are 3 answers that are absolute. And an absolute is an all, always, no, where this one has a usually in it. So that means absolute, 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 not absolute because it's usually. So it's the only one that's like that, so you would have to answer that question. This says the reasons, and we talked about, look at grammar, singular, plural. So if it's asking for reasons, the answer has to have more than one. And if you look at all these answers, the only one that has 2 answers in it is the first one. So you'd have to answer it that way. This is based on previous information, believe it or not. And we talked about this in question 1. And if you remember, we talked about the fribbled brig. And so that's how I came up with this answer. I'll take you back there. There's the fribbled brig. Okay. And now we're going to go to this answer here. And so that was from the other question. All right. Now we're going to go through a couple nursing questions. And this question is related to internal radiation, and it's talking about reducing the patient's anxiety. So when you look at keywords you're looking at, this is what it's asking about. How do I reduce the patient's anxiety? And you have 4 answers here. And you know that the first one, pain medication, does not reduce anxiety. It reduces pain, which is physical. You know that visitors being limited is not going to reduce the patient's anxiety. The nurse being available is probably going to be a good answer. The patient will not be radioactive. Once you study information about sealed internal radiation, you know the patient would be radioactive, so you can eliminate that answer. So again, focusing on patient anxiety and what's going to help remove or decrease the patient anxiety. And that's basically what this slide tells you. This is a knowledge-based question. So a knowledge-based question is something that you know. It's basically something you've memorized. And HIPAA guidelines preserve the right to patients' privacy. And it's a basic question. It's an example of basically knowledge. And that's the lowest level of questions you will get as you go in your nursing career. You're going to get a higher level of questions. This is an assessment question. So you're assessing, and then what are we assessing? We're assessing peripheral pulses. So if we know we're assessing peripheral pulses, we have these 4 answers. Do we palpate, percuss, inspect, or auscultate? But we know we're not going to listen, we're not going to look at them, we're not going to pound on them. We're going to palpate for peripheral pulses. If I change this to apical pulse, we know the only way to hear an apical pulse is to auscultate. So the idea behind this is, again, make sure you're reading each question carefully to come up with the answer. This is talking about, again, terminally ill patient with cancer. Patient states, if I get over this cancer, I will travel with the church next spring. What stage of dying is the patient experiencing? So we're looking at this statement, if I get over, and we're looking at stages of dying. You read the sentence, the patient isn't expressing anger. They're not denying that they have cancer. They're not really expressing depression, but in this case, they're bargaining because they're saying, if I get over this cancer, and why are they bargaining? Because the patient is terminally ill. So putting these pieces together helps you come to that answer. Here's an example of 3 answers that are correct and 1 that isn't. And so by just looking at the three, I shouldn't say correct answers, but three answers that are similar, you can come to the correct answer. A client with metastatic cancer is receiving morphine sulfate to alleviate pain. The nurse monitors the client for which adverse or toxic effect of the medication. And we are focusing now on what are the keywords. Well, this is adverse or toxic, not side effects. 3 of these are side effects. Dizziness, sedation, and nausea are side effects of morphine. And even though you may not know this is the answer, you know that these 3 are side effects. So that has to be the correct answer. Keywords. A nurse is assisting and caring for a client who has just returned from PACU or recovery room after going under surgery. So now the nurse is monitoring for early signs of hypovolemic shock. These all could be signs of hypovolemic shock, but we are looking for the earliest sign of hypovolemic shock. And we know that the first or earliest sign of hypovolemic shock is the pulse rate's going to increase because there's not enough volume in the blood system to go around, so the heart has to work harder to get it to circulate. These 2 happen later, and actually this is just wrong because the person would not become more oriented, they would become less oriented to the surroundings. These are examples of common keywords that you would use to prioritize. When you look at test questions, sometimes it's priority questions and it's looking at ABCs. Many times in nursing, ABCs are airway, breathing, circulation. So that's what you would do first. And so because this is about a patient receiving morphine sulfate, which is a narcotic, every 3 to 4 hours, when assisting in the plan of care, what is a priority action? If we think of ABCs, we think of airway, breathing, circulation. These other ones all relate to I&O, stools, urine output, so they're similar. This is the only one that relates to coughing and deep breathing, and it is a priority question. It's also the longest answer. But that is how you can come to this question, even if you're not sure of the answer, because you've put all this information together. This one looks at assessment. So it's an assessment question. A nurse is caring for a client with COPD. The patient complains of increased dyspnea. The client is on oxygen at 2 liters per minute, and the respiratory rate is 22. What should the nurse do first? Remember, this is an assessment question. 3 of these are interventions. So if you are looking for an assessment, you would check their respiratory status. You don't know why they have increased dyspnea. You don't know if the oxygen tubing is kinked. This is pretty common. Respiratory rate is 22 is not unusual. Once you do your assessment, then based on that information, you might call the doctor and get an order for increased oxygen or contact the respiratory therapist. This again is just wrong. You would never tell a patient not to worry. But again, you're looking at assessing. This is a planning or intervention. A nurse is preparing a patient for a gastroscopy. The nurse plans to put the patient in a supine position, monitor the vital signs every 4 hours, provide saline gargles, check for gag reflex. When you have this knowledge, you will know that you would, after a procedure, a patient's vital signs are never checked every hour for 4 hours when a person just comes back from a procedure. And you wouldn't lay a patient who just had something in their throat flat. So that would be knowledge information that you would have. You would know that you would check for a gag reflex after they've had a gastroscopy because their throat was numb. And you'd have to have a gag reflex before you could give saline gargles. So again, this is a checking for the gag reflex so you can do the next intervention. This is a higher level question. It talks about a patient with eclampsia, and if the nurse understands if the patient's going from pre-eclampsia to eclampsia, and what would they do first? If you didn't even know anything about this disease process, if you looked at these three answers here, they're all related to oxygen, vital signs, check the patient's blood pressure, fetal heart tones, airway, oxygen. So this one is set off all by itself. It is the correct answer. You would give meg sulfate, but these three are similar. So that's an example of similar answers that you could group together. I'm going to skip over some of these. I'll go to this one. This is similar answers. An LPN is caring for a group of patients. She determines which client is at risk for excess fluid volume. So if you have too much fluid, why? If you have ileostomy, you're getting rid of fluid. If you're on diuretics, you're getting rid of fluid. If you have a GI suction machine going, you're getting rid of fluid. This is obviously the correct answer, but these other three, you're all getting rid of fluid. So that is how you would determine, another way to determine this is the correct answer. This is an absolute answer, meaning if you looked at these answers, all of these have must, must, must. This is the only one that has will in it. A nurse is instructing a postpartum client about infection prevention. The nurse determines that the client understands instructions when the client states which of the following. Based on, these are all wrong, but this you can choose this answer because it does not have an absolute word in it. So those are just a few examples of test-taking strategies. Test-taking strategies is something you have to practice. One good way to do it is to buy the Saunders NCLEX book that you would have through your whole nursing career. It goes over test-taking strategies in the beginning, and you can use it whenever you're studying a certain part in your med-surg, OB, foundations. It's a good addition to learning how to prepare for the NCLEX and practicing NCLEX questions. So I hope you found this useful. Again, it's not something you will learn overnight. It's something that you do have to practice.